Classification of non-union. Non-union is classified into infected non-union and non-infected non-union on the basis of presence or absence of infection at the fracture site. Classification of non-infected non-union. It is done by the Weber and Czech classification given in 1976, which classifies non-infected non-union into hypertrophic non-union, oligotrophic non-union, and atrophic non-union. Hypertrophic non-union is characterized by hypervascular fracture ends and abundant callus formation. Oligotrophic non-union has minimal callus formation along with adequate vascularity of the fracture ends, whereas atrophic non-union, there is no callus formation and there is impaired vascularity of the fracture ends. So we can see that in hypertrophic and oligotrophic types, there is both some degree of callus formation and presence of vascularity. So these two types are known as biologically active non-unions, whereas atrophic type is known as biologically inactive non-union. In hypertrophic and oligotrophic non-union, there is a potential of the fracture ends to heal biologically if adequate stability is provided. So the solution in these cases is providing adequate stability. Whereas in atrophic non-union, along with stability, we have to add some other agent to induce bone formation as these fractures are biologically inactive. So normally in these cases, we have to add what we commonly call as bone grafting to improve the biological potential of these non-unions. Coming to hypertrophic non-union, it is sometimes classified as elephant foot and horse hoof type. What are these two types? In elephant foot, there is hypertrophic ends with excessive callus formation, whereas in horse hoof type, there is mildly bulbous ends which exceed the thickness of the bone. So both these types are type of hypertrophic non-union. However, in elephant foot, there is much more callus formation, whereas in horse hoof, there is a mildly bulbous end which exceed the thickness of the bone. Both these non-unions are caused in patients who have good vascularity of the fracture ends. However, there is inadequate fixation or immobilization or premature weight bearing. If the fixation is grossly inadequate or the immobilization is grossly inadequate, then there is a tendency of elephant foot formation, whereas in horse hoof, it occurs when there is a moderately unstable fixation. So these two types are differentiated on the basis of degree of callus formation and the degree of lack of stability or fixation at the fracture site. Coming to types of atrophic or avascular non-union, these are classified into four types. First is torsion wedge, second is comminuted, third is defect or gap non-union, and fourth is atrophic non-union. In torsion wedge, there is a butterfly fragment which unites with one end and fails to unite with the other end. In comminuted, there is a necrotic intermediate fragment which fails to unite with either end. In defect or gap non-union, there is a loss of the fragment and gap at the fracture site. Whereas in atrophic non-union, the bone ends become atrophic and osteoporotic and the ends are tapered. Another classification that is commonly asked is the Paley classification, which is specifically for leg bones. Paley classifies leg bone non-unions into type A and type B on the basis of bone loss. If the bone loss is less than 1 centimeter, it is type A, and if the bone loss is more than 1 centimeter, it is type B. Type A is further classified into A1, which is a mobile non-union, and type A2 is stiff non-union. Type A2 is further classified into A21 is a non-union, a stiff non-union without deformity at the fracture site, whereas A22 is a stiff non-union with a deformity at the fracture site. Type B is further classified into B1, B2 and B3. In B1, there is a bone gap. However, there is no shortening of the bone overall. In B2, there is shortening of the bone. However, there is no bone gap. And in B3, there is both shortening and bone gap is present at the fracture site. Coming to infected non-union. Infected non-union commonly uses two classification. The infection part is usually dealt by the Tierney-Mader classification for chronic osteomyelitis. This classification has already been described in detail in another video. The other classification is the Umyarov classification for infected non-union, which takes into account the viability of the bone end, presence of any limb shortening, and presence of bone and soft tissue defect. According to this classification, we have four types: type 1, 2, 3, and 4. In type 1, we have a normotrophic non-union without any shortening. In type 2, there is a hypertrophic non-union with shortening. In type 3, there is an atrophic non-union with shortening. And in type 4, there is an atrophic non-union with a bone and soft tissue defect, which usually presents with shortening. So friends, this was a discussion on the types of non-union, which is a very important topic for postgraduates. If you like these videos, please hit the like button and subscribe to the channel for further videos. Also, comment in the comment section regarding the topics you will like to be covered in the future videos. Thank you.